Welcome and good morning, afternoon, evening. Easier to say good day. It is a pleasure to have you here. Thank you for joining us for the changing world of healthcare. How do we strive? My name is Brenda Batista-Mollohan. I'm your presenter for today. A little bit of background about me. I have been working in healthcare for over 25 years and thoroughly enjoy it. I would do no other industry. And I have seen many changes, as you can imagine, over that time. And it is my pleasure to share with you today some of those learnings and talking about how do we deal with change in healthcare. So just a bit about this particular webinar. It's intended for your healthcare professional personnel and managers who are interested in improving the quality of healthcare by fostering change in the process of care and the performance of their teams and practitioners. So it should be of assistance in conceptualizing how to promote change and how to overcome barriers to change. As you know, sometimes people get a little hesitant about change or a little worried. So in particular, we'll discuss the following topics. First, we're going to talk about an overview of how to develop quality-based healthcare strategy. Then we'll dive into strategies for improving the performance of healthcare workers in particular, before ending and wrapping up with how does technology help people embrace change? All right, so let's go ahead and get started. So let's talk about, the today and tomorrow's health challenges. As I mentioned, I've seen many changes throughout my time in healthcare, and certainly there have been impacts and changes before that, whether it was different payment models, different attention to quality levels and what's going on in healthcare. How do we impact the quality of care, the outcomes? Sometimes, no, I shouldn't say sometimes, it's always been access, cost, and quality. These are the three things that are consistent in needing improvement when we look at healthcare. And how do we get that to our people, to our populations? And if we look around the world, every healthcare system is struggling because we have rising costs, inequity, and disparities in our quality and access to the healthcare for folks. And although we have well-intentioned and well-trained clinicians, healthcare leaders and policymakers they've tried many fixes across the time to address the different issues of access, quality, and cost. But in particular, when we look in details of that, we take it as segmented problems or opportunities that we try to address because we want to limit scope. And because of that, we focus on things like just fraud, what's going on with fraud in the system. Or when we look at the clinical side, we focus on medication error reduction or medical error reduction. Doesn't have to be medication, but also, medical errors. We don't want things to be happening. So you kind of focus and limit the scope. Sometimes we look at practice variation. How are different providers who do the same work and treat the same disease progressions, how are they doing things differently? Because obviously that impacts the cost, but then also can create different outcomes. Patient access to care, as I mentioned multiple times here already, because it's so important. Do we have the right access points? Are people interacting with our healthcare opportunities, our services, if you will, to make themselves better? Are they seeing that? Are they able to get in? Can they get an appointment when they need to? Do we have enough providers in the population to take care of what ails them? So they're not waiting 3, 4, 5 weeks to get a simple appointment. For example, in the area that I live, I needed to see a primary care physician. When I called in to get an appointment, they said, "Oh, it's 6 weeks out." At that point, I said, well, okay, my problem will either have completely disappeared by then or it will have become much worse. Now I'm opting that it'll be completely disappeared. It'll just run its course. Hopefully it's not part of something bigger. So That certainly is an issue that comes out of access, and an unfortunate byproduct of not having enough access, not having enough access points, providers keep capability and capacity to treat the patients. And then certainly we don't want to forget about the availability of health data. When you're in the system, you're in a particular hospital or physician office, of course, it is there, the data is there. But we know that we're transient, meaning as we move around in the healthcare continuum, as patients, we need our data to move with us, regardless of if the providers are using the same system or not. We need to have our latest information. Every time you go to see the physician, besides asking who you are and what your problem is, immediately we get into medication. What medications are you on, over the counter as well as regular? What are some allergies that you have? You need to know this. And if we're not in front of that, we get behind it. So whose responsibility is it to take care of and have that information available? It's really a combination, right, of us as patients, but then also us as industry professionals. How do we get and share the information? Because when we take a look at all of these things individually, are we really treating the whole system, the whole issue? But you're treating this in piecemeal fashion, and the answer is probably not. So the question is, how do we change the trajectory to really focus, as I mentioned, not just on these piecemeal fixes, but overarching solutions? Well, first, we have to realize that the transformation is not a single step. So instead, it's a strategic approach that focuses on the larger benefit of value. So what I mean by value is value as an exchange of resource investment. So as we think of our organizations and groups investing to produce the most benefit to the largest population possible. So it's a strategic view of it, and that broadens the scope, which is a little scary for some folks to think about, because how am I going to solve every problem? I'm not saying solve every problem. I'm saying prioritize what is the greatest need in your market, what is the greatest need of your patient population, and that's the approach to the benefit. And so it requires a mindset shift, though, and a restructuring of how healthcare delivery is organized, measured, and reimbursed. And here in the US, we saw some of that historically about reimbursement changes instead of fee for service. Any variation away from fee for service creates concern, because the organizations are trying to figure out, how do I adjust to that? How can I survive as an organization? Because I'm still really a business that I have to have profit. I'm not talking about huge amounts of profit, but certainly enough so that I can carry forward in our mission. So for the transformation really to occur, though, it has to be sustained from within, meaning from within a healthcare organization. It has to be something that they decide to do, not something that's done to them. And I think that's true in general when we look at change for an individual as well as organizations. It has to come from within. The motivation has to be from within, and not regulatory requirements only, not outside or external constraints or pressures, but really a motivation from within. Because ultimately the value is determined by how medicine is practiced. And so the physicians and providers who are inside your organizations or inside your systems, they're in the best position to drive the change, because they're going to implement interdependent steps. So if you look at the continuum of care, it's not just the episode of what the patient's being treated for today, but how we treat them long term. So the providers, as you think of them perhaps as a relay team of, join point by point by point by point, the patient shouldn't have a degradation of care as they go from one provider to another, because their care is progressing. They need to see somebody else. But how do we create that continuum that's almost seamless? And as mentioned, it starts with the providers, because they really can be the champion of change, and they have to determine how to coordinate their efforts. So one of the things that I highly recommend is internal to your organization is selecting a champion. Have somebody, because you want to have accountability, but you want to have this person really be the one who coordinates the efforts and creates the plan that engages each stakeholder in the healthcare system. So it's not just providers, but it's everybody who produces or, I should say, impacts the patient's journey with you. So that includes people like accounts receivable, which a lot of times we forget about. We forget about that, but the bill seems to be one of the most complicated things outside of the science of the care that patients, it causes dissatisfaction, but that they also get lost in. So stakeholders, think broadly about the stakeholders in the healthcare system, because they all have a role to play. And the patients, also include them in this journey and what is the need. So not only the market research about what the population demands are based off of disease progressions, but the patients who are with you are regular quote unquote customers, consumers of your services. Engage them, engage the health plans and the insurers that are you're contracted with, about how can we transform and change what we're doing. Because our healthcare challenges, they will always exist. As I mentioned, the 25 years, access, quality, and cost have always been the things to address, the issues, the challenges, if you will. They will continue to be that, because they will always be working towards making those better. And that's why we need to train our teams as in total to become familiar with the newest technologies, the trends, the global trends, and how to create a quality-based approach to strategy. So let's talk about implementing QAPI. Now, QAPI is really is the coordination or the application of, if you will, of two mutually reinforcing aspects of quality management. The first is quality assurance, the QA part of it. And the second is performance improvement, the PI. So QAPI takes a systematic and comprehensive data-driven approach to maintaining and improving safety and quality in healthcare organizations. Now, when we look at QA, and so why these make a happy marriage in what you do and how to improve quality, is QA is focusing on the retrospective review. What happened as a result of the process? Was there a harmful result? Was there something abnormal? For example, if we look at something like medication administration process, the processes that go into that, we're looking for factors like, was the right drug given? Was it given at the right time, in the right amount, to the right patient? You see all these types of checks, but all those are literally after the fact, but still provide important information, because it's telling you, when you look at it in aggregate, what's the standard? What's the standard of our process? What's the standard of, I'm not going to say of care, but what's the standard of how we do our medication administration? How many times are we coming really close to, oops, almost I made a mistake. And the severity of those mistakes could be catastrophic in instances, but also just as we, like to classify them as near misses, which, oh, we almost made a mistake, but we caught it. It's important to know that. So it's the QA, the quality assurance retrospective is great, because then we can determine the standards, how we're varying from the standards, and determining the magnitude of the variation. So the magnitude of variation, so we understand the impact. Now, PI, the performance improvement part, builds upon the QA because we're going to start asking about questions about what we can do to minimize the variation and improve outcomes by disrupting the patterns that we're seeing in that retrospective review. So we're going to try new techniques and approaches in the PI portion. So this is the opportunity to watch and monitor the results more real time. So if we try something new in our process and we know we implemented it, we need to watch and monitor the impact of that. If the impact is a positive one, certainly want to reinforce that change and make it part of the standard. But if we're finding that the impact is negative, which it can be, we want to make sure we get in there quickly and modify. And so this requires, as we'll talk about later, that our teams have to be really in sync with the change and not afraid to change, but also understand why are you doing, why are we making these changes? Because it'll seem like, oh, they're wishy-washy, maybe. We made a change and then they backed off and they're doing something else. It's like, it seems like we're not decisive because we keep going back and forth, but it's just the nature of change and the nature of performance improvement. So some suggested steps for performance improvement and building this into the strategy, because you need to see how we can pull that in, is determine the objective. In other words, why do we need to change? What's happening? What result do we want? And we want to prioritize the actions and initiatives. So we do what matters most first. We're not going to do everything because we can't do everything. We're going to do these in a structured order and layer them on each other. But we also want to brainstorm approaches and involve the stakeholders. So the people who do the work know best what has worked, what doesn't work, and will embrace the change, or they'll find workarounds. What we want them to do is embrace the change and be part of the solution. So involve them by brainstorming. Determine what you're going to do to make things better. So that includes them in doing that. Select the measures that matter the most. So this is not just implementation progress, meaning some of our initiatives take longer to do than others. This isn't just progress on a project plan. This is, how do we know, excuse me, how do we know the impact the change is having? Because as I mentioned before, it's super important to understand that. Then we're going to evaluate how's it going continually. Hold people accountable by sharing those results openly. Nurture the change by developing training, changing work assignments as necessary, and then asking them for feedback. So don't be afraid to ask and engage them in feedback that's constructive. So I'm not talking just about complaints and what's not working, but what are solutions? How can we make it work? What suggestions do they have for making the change lasting and sustainable? So as we now transition a little bit more into strategic plan, so tying that quality approach into the plan and how to make that strategic, we got to remember that our strategic plans, first of all, are not just something we do, every 3 to 5 years, make a beautiful report and put it on a shelf. That's not particularly helpful. Just to say we've done strategic planning. Strategic planning is an ongoing, it's a very dynamic and living document, if you want to think of it that. It's a dynamic process that should be revisited frequently, more than every 3 to 5 years. Although we plan on a 3 to 5 year trajectory, we do need to review these a little bit, not a little bit, a lot more frequently. And so the effective strategic plan is going to require that comprehensive review and evaluation of both your internal and external influences. So what I mean by that is, for external review, we want to start with a market evaluation. What is in demand? What does the population need based on their age, the demographics, disease projections, and consumption trends? So what's forecasted and what's currently happening. You have to understand both sides of that coin. Then look at what are the industry experts saying. So those who do out their research reports about shortages of providers, as an example. How's that going to impact access? How's it going to impact quality? What's it going to do to cost? What are they saying in these research reports? Understand what the essence of that. Then you need to determine your total available market. So your total population size. Then you're going to narrow that down to the serviceable market. So there may be some services you provide or some services you're thinking about providing. Who needs that in the total population? And the reason you're doing that is you're trying to establish the size of your opportunity, the size of that future opportunity. And then you're going to narrow it even further to what's the obtainable market. So this is where you have to understand what are your competitors doing in the space? How much market share do they currently have? And how are you going to, dig into that a little bit? How are you going to take some of that from them? Or if the market size grows itself, what percentage would you like to capture? So as I mentioned, you're going to look at the competition, understand what they're offering, how successful they are in their endeavors, so that market share percentage is definitely part of that. How are they differentiating what they do? So what are they specifically saying about quality or their offerings or that sort of thing? And why I pick quality is if that's going to be your turning point or what you really kind of sell to the population that you are better than, you've got to demonstrate quality, not as the comparison we're better than they are, although that's your intent. That's not what you're saying to the public, and not what you're saying to your teams. It's more about quality because it's built into what we do and it's who we are. It becomes an immutable law of how you perform and guide your teams. So while that's the external view, I said you also have to look internally. An internal review is part of your strategic planning. So you should take stock of your capabilities and limitations. A SWOT analysis, strengths, weakness, opportunities, threats, is a great analysis to do. It's very useful when augmented by the results of a stakeholder survey. You want to survey those folks who are internal to your organization about what's working well, what's not working well, how can we be better? Because you want to understand what it's like to be part of your organization as both, I'm going to say, an employee or somebody who's affiliated with your organization, as well as a customer or patient. So by combining the findings from your external and your internal assessment, you get a robust perspective that helps formulate the vision and strategic objectives that's going to help your organization grow. You want to be sure to identify and prioritize those quality-based objectives. They're going to serve as your effective building blocks and resonate with the patient population you want to capture. So when this is done well, a strategic plan, as you see on the slide here, when you do this really well, you're going to gain the perspective and insights from having done the external and internal reviews. You're now able to align your internal efforts with the goals, the strategic objectives, everything will be in alignment. And you're going to select those best investment opportunities. Remember, I said before, you want to invest in the opportunities. They're going to bring the best benefit to the population that also ties to what your organization wants to be known for. So now let's transition and talk about SMART goals and alignment. So this really ties to alignment because now we're starting to drive to the individual, but I also talk about this in context of projects and programs, because from your strategic plan, you're going to have specific prioritized initiatives, as I mentioned before. Those initiatives have to have SMART goals. And the people associated with getting that work done also need to have SMART goals. This is all part of reinforcing change and making sure that the teams are aligned to change. So we can focus on workforce on this, and this does tie to workforce. So we're going to talk about how do we engage the employees. We're going to ask regular questions and give regular feedback. So, as I mentioned, if we want change to actually stick, meaning be sustained and not just be a one-time event, so change is never just one and done. It's a continual effort. We often find it's so complex that and not easily accomplished because we're typically not investing enough time to make the change sustainable, or we're not doing enough on the planning side to really align our teams and our individuals to the strategic goals. And most organizations, unfortunately, take a haphazard approach to um, employee reviews and employee involvement. And what I mean by that is they'll do a biannual pulse survey. In other words, what do you think of our organization, right? So every couple of years, they'll usually do that to see if they're on track with what they want to have as their internal culture. And might take some learning points from that, some lessons learned and strategic plans from that of how can we become better every couple of years. As far as the individual, though, sometimes we get annual, I'm going to say sometimes because I'll share with you some stats on this in a moment, annual performance evaluations that are really, I guess I can speak for myself and multiple people I've spoken with. When in an organization, it was an annual review that was really just about, if it was an online system, just fill in the check marks. Yep, I did it. Yep, I did it. Yep, I did it. And that was it. There was not a discussion. If I was lucky, there was discussion about where do you want to go and how can you improve? And these are things you do really, really well. And here's some improvement points. I will say that most of the bosses I have had over time never got to the how can you improve part, because it was not because I'm perfect. That's definitely not the case. It was really because they weren't equipped to have the conversation in a constructive manner to say, how can I improve? What are those learning points? What are my growth edges, if you will, that will help me propel in my career? They were just ill-equipped to handle that or even to do it. So asking questions, though, is one way to see improvement for your teams. And now I'm going to share now, there was a recent survey done by Giant Worldwide, and they work with Fortune 500 companies across the world. And they asked these questions. And then it's shocking to me, some of these results. For example, only 26% of employees receive effective ongoing feedback, according to the employees. So while I just shared that I didn't have anybody that really gave me how to improve, I wasn't alone. So 26% of the people think that they actually do get that they do get good feedback. The rest of us, no, we don't. It's not happening. 21% have performance metrics that they're held accountable to. So why that one is sad, I guess is the best way to put it. 80% of people in the workforce, not just healthcare, but in general, do not have evaluation metrics that they're held accountable to. So just think of the impact of that. You come to work every single day as an individual. You do your job, and you assume you're doing your job well because nobody's giving you the feedback. Nobody's asking you, how are things going in a meaningful way? And then suddenly, nope, well, we're done. You're all of a sudden you're out of a job and you don't know why. Well, that didn't make any sense. I never received feedback that I was performing poorly. Yeah, we just never getting feedback to you. So you can see how that causes a disengagement with the team. And then how are they really supposed to embrace change if they don't know that what they're doing could be done in a better manner? We're just not sharing that with them. We're not explaining that. So as I mentioned before, these are really shockingly low numbers, and they highlight why it's so difficult to change behavior. when you rarely tell somebody how they're doing, how are you supposed to hold them accountable? You can't hold them accountable for results. And how are they going to really connect to that need for change? So one fundamental way to resolve that is to ask a very simple question, and that's, what are your goals? So use SMART format. This is a format that most people are familiar with, because you want to create a common way to communicate about performance. You want the specific goal, you want it specific, you want it measurable, and this is one that people struggle with, is on the M of measurable. Is it attainable, achievable? Okay. Is it something that is it's a stretch, but I can reach it. I know I can do it. Is it relevant? Is it tied to what my job responsibilities are? And is it time-based? Meaning, you don't want something that, oh, I'll do it someday, because there's really no motivation, there's no drive to get it done. So time-based is very important. It's also one that people shy away from, and they're afraid to put time bound because, oh my gosh, a deadline. Now I really have to get it done. And the answer is yes. That's how we create that accountability. But it should be, this format, this framework, if you will, should be applied to individual contributors, leadership. So executives, managers, directors, so forth, also should be following this framework. You need the framework to be consistent throughout your organization, as well as to projects and programs. As I mentioned before, your projects and programs need to follow the similar approach. It needs to be built into either your project charters or your overall expectations or plans. However you are describing your projects and programs, they need to include this framework of SMART goals. So the reason is to create the common nomenclature, the common communication ways, if you will, and to keep the team engaged, because you can now create a cascading effect of strategic objective to initiative, project, or program. Those are all the same thing. Then to whatever my role is in the organization is now tied to strategic objectives. I see how those all tie together. But you're going to play to the strengths of the team in total, and identify the weaknesses. So how can we get better? Where should we be getting better? How do we augment what we're not really strong at doing? And provide the challenge to grow. But you want to provide support so that they can achieve those goals and objectives. So when we apply the SMART framework to an organization, we're going to roll it up to the org level. We need to consider the following things. And that's, who is this organization to its patients, staff, and community? In other words, what is our identity? What do we want to be known for? Where do we want to go? Do we want to continue on our current path and purpose? Are we expanding? Are we contracting? Because both of those are legitimate, directions to go. And are we changing our purpose? What are the measures for success? As I mentioned before, this is where a lot of folks get stuck, because you have to make sure they're meaningful measures, not just whether we did something or not, not the binary measure, but also the impact. Are we moving in the direction we want to go? And not just assuming because we did it, it must be great. That's a misconception I see people do a lot. Also, you need to determine your data source for your measures and the frequency of reporting. This is more than annual. It's definitely at least quarterly. And if you feel comfortable and can get to the data sources to do it more, more frequently, you should. When do we want to achieve our objectives? How are we going to accomplish this? And how confident are we that we can accomplish the goal? So remember to continually track your performance, and don't be afraid to ask those hard questions. Now let's look at the framework to establishing an empowering environment. So we look at the quality of healthcare. It has three really interrelated components. And now we're starting to transition into the patient realm along with our employees, right? One is, and these are not in any particular order, but it's technical care, interpersonal care, and the organization of care. So we probably should start with some definitions. Technical care is where that's using our medical knowledge and technology to maximize the benefits of care for the patient while minimizing the risk involved. And I'll share a couple examples a little later in the next slides. Let me talk about interpersonal care. This is the psychosocial part of our dealings with patients as providers. So we want to make sure that in a larger social context, that we're providing the right care in the right manner, in the right tone, so it's received well, and that patient-provider relationship, which is still the core, at the core to our providing excellent quality. It's probably the top technology, if you could call it that, that really drives the patient experience, helps the patients cope with what's going on, and it's why we need to really care for and make sure that our employees, staff, resources, providers, however you're defining them, are well cared for. It's our responsibility as leaders to make sure that that's happening. And then the last is the organization of care. That's, again, back to that accessibility, timeliness, efficiency, and scope. Do we provide the right services in a way that is effective in the treatment and or well-being of our patients? As I mentioned, the biggest influencer of all these is the components that relate to the healthcare provider. So to boost the quality of healthcare, we need to take care of those providers. We need to focus on providing them with effective team communication so that they're not making up their own narrative about what's happening in our organizations. We want to provide a framework to build relational trust so that they fully understand that while it's challenging working in the environments, we're here to support them and we have support mechanisms in place. Otherwise, this is where we start to see that, the burnout and that sort of thing. We want to share the strategic objectives so they see how they contribute to those and are vital to the success of the organization. In a word, that would be alignment. We want to align them to the overall goals and let each person know they're working on the right things. This is about execution, meaning executing on the plan. They are contributing to the overall goals and outputs, and everything they do, they can see how it ties to that. You should not have somebody coming to work saying, I'm just a unit clerk. There's no such thing as just in anything. You are an integral part of our patient care and providing the services to our patient population. Without you, we could not we could not exist. We could not move on. And then finally, make sure you're utilizing their capabilities in addition to their skill set. So there's a line there. They may be really great at the skills, but they have other capabilities you haven't tapped into yet. You have to understand what those are, because that's what causes and creates an engaged community, an engaged employee, and an engaging culture. They're now empowered because you're finding out what they want to do, not just what they're good at. So one of the things I will underscore here is when you do that and you take this approach, they will support the changes that are made in the organization. For example, when providers embrace technology, they make the patients feel comfortable with technology. So if the patient hears the provider complain about something, or they hear a little distrust, or they sense something not quite right, they will take that attitude as well. But the provider is saying how technology is helpful and how it's going to make their care better. They trust that. Back to that relationship, they trust what the provider is saying. If the provider is endorsing something, they will endorse it as well. They'll embrace it. One of those things, if we look at the digital future, artificial intelligence, this is one of those areas that people unless you're in it all the time, probably don't know that much about it except for what you hear in the media, which can be a little bit scary sometimes if you don't totally understand. But this is one of those technologies that, as I said, they may need some more support, but really to understand how this type of technology can cut scientists' time by helping to analyze data, testing different research combinations, and tweak formulas in a way that's faster than we've ever been able to do it before, and is truly an advantage and an advancement. And that, we were seeing this in the pharmaceutical research and development labs. They're using AI to predict the relationships between biology and disease. So that means that we're going to be able to get to treatments faster and prevent progressions. But the general public doesn't hear that or know that all the time. So AI has the potential to improve the diagnosis and treatment plans. Provider who can share relevant use cases with her patient is going to increase the likelihood of adoption by the patient. So if the provider is able to share, you've heard this thing, don't be afraid of it. Let me tell you how it's helped get us where we are now. So we can map our digital transformation in healthcare. We just need to make sure that we have great use cases that lead to improved patient care and show better access, outcomes, and reduced costs. If we tie that narrative or that story together for patients, they'll get it, and they'll start to embrace these changes. And all these changes are for our betterment of healthcare. Two other things that kind of come up in the same realm, apps. People are really pretty comfortable with apps generally at this point, but and wearable devices, right? Depending on our age groups, the demographics, some embrace these a little bit more than others. But certainly you want them to understand about apps and data capture. So this also is an area that could get, through media, misconstrued about how it can be helpful and how powerful it can be. So this free app that you see associated, displayed here, this Living With, helps cancer patients connect with loved ones and manage appointments and record how they're feeling. So the app syncs with the fitness wearables and allows patients to share the more complete portrait of their health with their doctor, so the physician can get, reports from this to understand what is going on and make better treatment plans and treat the entire, not just the science of the disease progression, but also mentally how we're responding to it and how the patient's responding to it. On the other side, you see a wearable there that's for tracking activity and heart rate and logging infusions and bleeding episodes. So with that much information, the healthcare provider is more empowered to take action and improve the healthcare of the patient. So it's a more active role, but again, we need the patients to adopt and adapt, right? These types of digital influences into the life in a different way. Everybody has a phone at this point, pretty much. And don't be afraid of the apps. Most of us use wearables, and also don't be afraid of those wearables because they can really help our situation. So we look at improving attitudes. This is for work culture and empowering employees. The average team wastes time, regardless of where you are, with drama that really can, I've seen instances where this is like the level of soap opera and then you get hostility that causes you to not collaborate effectively, or we're not going to talk to them. That's their problem. They do that. That's beyond my pay grade. These types of things, you hear that means there's some hostility. It could be person to person, or it could just be there's people starting to disengage and feeling frustrated, excuse me, because they're not aligned and they're not focused. They feel like there's a lack of there is a lack of execution. It's leading to missed targets, and then that unrealized potential. You could have high turnover, and just as I mentioned before, disengagement with folks. So when you have folks that are there just for a paycheck and no more, that's really an indicator you need to do something with the culture. So how do you avoid excuse me, what I just described. And it's really to be intentional. You want to be intentional with your culture. Don't let your culture happen to you, but be assertive in how the culture is developed. So you want to choose to implement some initiatives that, one, create a culture of caring. This is not just caring about the patient, because that's what we do. We care about our patients. We want to provide clear expectations. Don't be in that 21% of folks who don't have metrics. Well, don't be in the 80% who don't have metrics that hold their teams accountable. Encourage cross-training. This is a great way to get outside the skill set and into capabilities. Establish open and frequent, transparent communications. Tell them when things are going great, but also tell them when the problems occur and the details. Because as I mentioned before, we are very creative people. People are very creative, and they will create stories that are should be novels, right? That's not what you want. You want them to know the facts of the situation. Treat everyone with respect, reward their performance, nurture the staff, and last and certainly not least, encourage dream chasing. Encourage them to go to the next level of whatever their capability and dream is related to that, which may be outside the job they're currently holding, and that's okay, because you want to engage them and say, this is a place for you to grow and continue to be with us. And now, as we look at improving patient care, so once your employees are empowered and have this positivity going, it becomes contagious in a very good way. So they can improve patient care because they're going to be, I'm going to say more happy, but they're going to be projecting an attitude of, we've got this. We're here to serve you. They're just engaged and energized, I think is the better word to say. You've got an empowered, energized employee base. They're going to project that onto the patients. And clearly, you can do things like a patient-centered approach, the 8 aspects that were mentioned by the Picker Institute and Harvard Medical School, that include things like respect for patient values, preferences and expressed needs, coordination and integration of care, information and education exchange, making sure our patients are engaged in their own care, physical comfort, of course, emotional support and alleviation of fear and anxiety, involvement of family and friends, continuity and transition, and access to care. So we keep coming back. Access to care is very important. So you must do everything possible to provide the proper environment for your employees to thrive and improve, which in turn will enable them to provide that excellent patient care because they are empowered and energized. Therefore, they will energize and empower the patient to take and be more engaged in their own care. So that's the last slide that I have, and I think we have some time for questions.
Thank you, Brenda, for this great presentation and for your time. I hope everyone enjoyed it. Thank you, everyone, for joining us today. I just want to mention before we start the Q&A is we're going to be sharing this webinar on our social media accounts on Facebook and LinkedIn at American Institute of Extended Studies. If you don't follow us, you should. We can now take questions. You may unmute and ask your question or type it in the chat box. I can forward it to our speaker today. Any questions you have? As we wait for more questions, there's one question I received. So when giving feedback, do you recommend doing it in person, scheduling a meeting with each staff member, or do you just say we send them an email with their evaluation and how to improve?
Yeah, it's a great question. I recommend both. So most systems provide that access to their own review because we do a personal review and then the manager adds their comments usually, and the system provides that back to the employee. I do encourage that you remind the person that that's available for them to review your comments before coming in to meet. And the reason I say that is because it gives them time to think through, to read your comments and then think through their response to that. And then I would meet with them because when we write, we often lose the tonality. And depending on how well we write, sometimes we may have written something that was unintended. So what I mean by that is, we can take a tone that, or I'm sure sometimes you receive an email and that your first reaction is, what's that about? And you have this kind of negative defensive response. And that's not what an effective meeting with the employee is about. Is to take those defenses down and say, no, I'm sorry if it came across, or I reread it and it's like, oh my gosh, I'm going to change that. That's the reason to give them that in writing. But I would always, always, always meet with them in person so that they have the chance to ask questions, and you can provide your feedback orally as well, because I think it's nothing replaces that opportunity. Even if you do it through Zoom, it's something you need eye contact because you need to see how they're responding to what you're saying.
Thank you so much. There's another question. Is it the provider's responsibility to recommend those health apps, or should you wait for the patient to mention it to the doctor or the staff members?
Yeah. The answer is it depends, because some organizations are being proactive in creating digital transformation approach, meaning beyond last year and the kind of the telehealth push. We were all pushed into telehealth situations last year for our non-urgent situations. Beyond that, I'm now seeing organizations be proactive and say we want to create a digital transformation strategy, and so they are picking solutions or apps or wearables that fit with what they want to suggest. So they might be working with some vendors, or they might be working with some partners, if you will, to create that, and then we'll provide that information to the provider saying, oh, if you have diabetics, here's our digital plan for them, some wearables and some options here and there, and this is what we're suggesting for folks. And not seeing that as strong as you would think. And for those patients that love Dr. Google, if you know what I mean, they will come to you with suggestions like, what about this and what about that? That I know that puts the physician and provider in an awkward position because you have to know everything about everything. But honestly, I would just take that on, and if you know of it, and if you think that wearables is useful, then yes. But does that mean you should be entertaining every possible wearable as something that would feed in to your practice? Not necessarily. So I would actually encourage providers, in lieu of your organization having a digital strategy, that you yourself say, well, this is what's going to be for my practice. And then once the organization comes together, you can combine those at some point.
Great, thank you.
Mm-hmm.
Do we have any more questions for our discussion? We have a minute left, so now is your opportunity to ask any question. Again, I want to thank everyone for joining us today, and Brenda, thank you for your time. This presentation will be available on our social media accounts, Facebook and LinkedIn at American Institute of Extended Studies within a week. So you can watch it as many times as you want. think we're running out of time. So thank you everyone and hope to connect. Have a great rest of your day.
Thank you all. Appreciate it. Have a wonderful day. Take care. Be safe.